Pamela, Shannon, thank you both so much for joining us here on APTN InFocus. Pamela, I'll start with you and direct this first question to you. Can you tell us a bit about the survey for our audience that may not have heard about the survey?
Yeah, absolutely. So we sent out a survey in the fall of 2020, so September to October, to every practicing physician in the province of Alberta to not only collect some demographic information that we don't really do very well, so we wanted to get a sense of that, but we also asked 2 explicit anti-Indigenous bias questions and 1 implicit anti-Indigenous bias question.
And Shannon, what prompted the survey? What made you guys sort of think, hey, let's send the survey out?
The most important part is that we know from the governmental reports like the Truth and Reconciliation Commission, as well as the In Plain Sight report, among others, that Indigenous people in Canada experience explicit anti-Indigenous racism in the healthcare system. And we have some information about how that structural bias or systems level bias plays out with, for example, the residential school system and the Indian Act. But what we don't really study very often or talk about very often is the source of these anti-Indigenous biases or the interpersonal anti-Indigenous bias that healthcare providers have. And we see glimpses of it in the news, like Joyce Echaquan's story, but we wanted to really document what is the bias of healthcare providers who create the system, who are part of the system, and who treat patients.
So then, Shannon, who took part in the survey? Where did this survey go out, and who took part in this?
We emailed the survey out through the newsletters of the Alberta Medical Association, the College of Physicians and Surgeons of Alberta, and through Alberta Health Services, with the aim to get as many reminders and notices to all practicing physicians in Alberta. We have about 12,000 to 13,000 practicing physicians in Alberta, and we had over 1,000 respondents.
Okay, well, that's a pretty decent turnout then, I imagine. And Pamela, what sort of questions were asked on the survey? I know you touched on the questions, but so what kind of questions were on the survey?
Yeah, so in addition to the general questions about asking where people practiced, what kind of specialty they were in, and general demographic questions, we asked 2 explicit questions about anti-Indigenous bias. And remembering that these surveys came out through employers and regulatory bodies, and physicians were still comfortable expressing their views. So the 2 explicit bias questions, the first was asking if someone felt cold or warm, so unfavorable or favorable towards Indigenous people. And the second was, do they prefer white European people over Indigenous people? And those were both little sliders, we call them thermometer questions, where they had to click on a little bar on their screen and slide it. So there was no trick. They could slide it as far to the left or the right as they wanted to, or they could leave it. They could leave it and not actually move it as well. And then we included an implicit bias test as well. So that is, some of you may have tried that already with different tests. It's a little keyboard-based keyboard-based test that measures your reaction and your response time to different positive or negative words and associated with different faces. And so we actually asked that question as well.
So then in that case, what evidence revealed that racism in the Alberta healthcare system exists?
Well, for that first question around feeling cold or warm towards Indigenous people, we had about 8% of responding physicians actually indicate that they felt cold towards Indigenous people. The second question about preferring white people or Indigenous people, 25%, so that's a quarter of all the practicing physicians in the province who responded to that question, actually indicated that they prefer white people. And then out of the implicit bias responses, it was just over 2/3, so 67% of physicians actually completed that question in a way that indicated they had an implicit bias against Indigenous people.
Were those numbers surprising at all to either of you, or sort of like, did you have any expectations going in? Those numbers. I mean, I'm just curious for both of you, your perspective on that.
That's a really interesting question, and we talk about this a lot because Pam and I have different answers to this. So as a white woman, I did feel surprised that my colleagues, physicians in Alberta, would, on a survey from their employer, indicate that they feel unfavorably or cold towards Indigenous people, or that they preferred white people. And I did feel surprised. And Pam and I talk about how that really shows my white privilege as not experiencing racism. Because Pam, I don't want to speak for you, but you weren't surprised, right?
No, I was not surprised. If anything, I feel like the numbers are probably a bit low because of something we call social desirability bias, which is just when people answer the question in a way they think is socially acceptable, or don't answer the question at all because they don't want to make they don't want to answer something that makes them so uncomfortable. But I think based on all of the stories that we hear from Indigenous patients in the media, the ones that go unreported, all of the experiences that many of us know that ourselves or our family members or our friends have gone through, I anticipate that this number is actually an underrepresentation.
Right, that's a good point there. And so for, I guess, I'll come back to you, Pamela, here. And what sort of reaction has there been to this survey since it's been out, and the results of the said survey?
Largely supportive. Definitely Indigenous physicians have been reaching out to me to say that they are pleased that we've done the work and that we're shining more of a light on this need, and there's quite an urgent need to change the health system. I have had Indigenous community members find me and reach out to me because they do, I think, feel that there's someone there who will believe them. I think generally there's a shift to wanting to make things better, but it's a bit early as far as the system's point of view, and maybe I'll ask Shannon what she feels about that too, but I think it'll take a while to shift some of the accountability structures in the system.
From my end, I received a lot of mixed comments, positive and negative, about the study. Unfortunately, I do feel that the racism that people have learned in Canada or have taken in Canada is so strong that people feel like even talking about racism or saying that anti-Indigenous racism exists is somehow oppressive towards white people or offensive to white people in a way. And so I have gotten emails from people saying that I'm racist towards white people for participating in this study and doing this study, which is, obviously not true, because we're just revealing an inequity and an important source of harm and disadvantage for Indigenous people in Canada. We have heard a lot of positive or people hoping that this inspires change, and so that I'm very hopeful that this study helps us really examine our attitudes, our beliefs, and our colleagues, and what we accept and don't accept from our healthcare professionals.
Well, what you just said is I wanted to touch on that topic, and what, in going into this survey, what were you guys hoping would happen as a result, and maybe are you seeing something happen as a result of the survey, and maybe what you hoped people would take away, maybe? I do think we're seeing some of the things that we wanted. So one of my objectives in the study was to bear witness and to document the existence of explicit anti-Indigenous racism among healthcare providers. Because interestingly, when Pam and I had previously spoken to leaders, advocates, other researchers, journal editors, people would always say, okay, well, we know that there's implicit biases, we know about system level biases, but there aren't really doctors who are going around saying, oh, I don't like Indigenous people, or I won't treat Indigenous people, and Joyce Echawan case is a one-off, is just bad luck or a bad apple or whatever. And Pam and I certainly didn't feel that that was reflective of the truth. And so I hoped that this study would speak the language of the healthcare system, and that it would be a research study that proved in a way that we understand it in medicine, that this is a problem, these biases exist, and they're part of that harm that we need to address.
Yeah, absolutely. And I think from my point of view, a lot of the work that I do is also around medical education and how we educate up and coming doctors and also doctors currently practicing. And so what this does is allow us to be able to focus some of that educational work to areas or specialties or geographical settings where we can see that there was higher levels of bias. And also sort of continue to garner support for some of the work that's happening. So we know that there's more sort of hands-on anti-racism training happening. So this continues to prove that need, because we have physicians who are practicing, who are seeing Indigenous patients, are willing to put their hand up and say, actually, this is me, I don't like Indigenous people. And the assumption that this wouldn't impact the way they treat someone in a clinical setting would be completely false, right? We know that this will have impact. So it helps further emphasize the importance of the way we educate and then the way we hold each other accountable too.
Right, absolutely. And last one for both of you here. Do either of you have an idea as to maybe what will happen next in regards to the survey and the results of the survey?
Maybe I can speak a little bit. We've been contacted already by people in different provinces or different clinical settings who are interested in exploring these similar kinds of questions in their own workplaces, which I think is really important. So we've been trying to make sure we have as many of those conversations as possible. And then I think there's some bigger conversations to have with like the Alberta Medical Association and the CPSA around, what structures do we need in place, what policies do we need in place to make sure that when these things happen or when these physicians are harming patients, that we can actually take action.
And I've been in conversation with leadership through the Cummings School of Medicine at the University of Calgary, with the College of Physicians and Surgeons of Alberta, with Alberta Health Services, about how our anti-racism work, our anti-oppressive work needs to better address these issues and how it might need to be restructured. And I think a big part of that is admitting to ourselves that we are part of the problem and our colleagues are part of the problem, because I think it's very easy to look at historical factors and distance ourselves from that, because I think it is very uncomfortable to say, how have I contributed to the harms that Indigenous people have faced in our healthcare system, and how has my own implicit and explicit racism contributed to poorer outcomes for people? I don't know that a lot of people really want to face that, or it's very uncomfortable even to discuss race, racism, colonization, oppression. And so I think that even having a way to talk about these things and to face these things is a really important first step. But it's a first step, right?
Mm-hmm. Yeah, it certainly is, and we'll have to look and see sort of what the next steps are from this. And this is such an important resource now that the survey is out there. And Pamela, Shannon, thank you guys so much. This is such an important talk, and I'm really glad that we were able to get the both of you on and speak about this. Thank you so much for coming on.
Thank you.